Welcome to Clerkship Paradigms, your travel guide to the third-year clinical clerkships. In this series, we discuss the approach to patients and the tools you need to be successful in each specialty. Neurology is a focused specialty that relies on a systematic approach to disease based primarily on the location and quality of the symptom. The physical exam is more focused and relies on eliciting discrete failures in motor and sensory capabilities from the patient. The greatest difficulties third-year students have during this clerkship are: number 1, performing a focused and effective neuro exam. Number 2, localizing the source of a neuro complaint. And number 3, creating a broad neuro differential that includes non-neurologic etiologies. So what tools does a neurologist use? The most vital tool at a neurologist's disposal is the neuro exam. We will give you a rundown of the neuro exam here, but the best way to learn it is to practice it over and over again. There are 6 main features. For the mental status exam, try following an abridged version of the MOCA in your head. It helps to review this once before seeing patients. The cranial nerve exam can be remembered by following the numbers 2 through 12 and testing them in that order. The motor exam can also be followed in order by the joints from head to toe. It seems intuitive, so follow that intuition. The deep tendon reflexes are the most objective portion of the exam. Coordination and gait are mainly used to determine cerebellar function. Finally, the sensory exam. Unfortunately, this is the most subjective part of the exam, and the most difficult to assess. As a physician, you will not have the time to perform every component of the neuro exam. Therefore, it is important to let your differential diagnosis drive which components of the exam you will perform. These exam findings are used to isolate locations where neurologic function is compromised, a technique known as localization. In order to understand how neurology approaches a patient, we need to visualize the physiology of the nervous system. There are 7 structures in the nervous system where we can localize a disease to, and they can be remembered by following the flow of their anatomic location from head to toe. They are the cortex, cerebellum, brainstem, spinal cord, peripheral nerve, neuromuscular junction, and muscle. And we divide into these discrete components because of the prime directive of neurology, localization. It is a key subject that you will learn in depth during this clerkship, so it is important that you anticipate using it to help prioritize your physical exam findings. Let's take a look at several of the major components of the neuro exam. How do they relate to the structure of the nervous system that we visualized earlier? And how do they help us prioritize our neuro exam findings? If we suspect a lesion in the cortex, for example, we would prioritize the mental status exam, which elicits findings unique to cortical activity. If we suspect a lesion in the spinal cord, then, we would prioritize the reflex exam, which is the best way to differentiate between lesions of the CNS and the PNS. From the peripheral nerves to the muscle, it gets a bit more tricky to localize. If we suspect a lesion in the neuromuscular junction, we prioritize cranial nerve findings. For example, ptosis diplopia in the presence of peripheral motor weakness. This combination of findings would tell us that the weakness cannot just be at the level of the peripheral nerve because it affects cranial nerves as well. The purpose here is to let the differential drive the exam. The term neuro exam should be thought of as a guideline or a menu from which you pick and choose the salient items for the specific patient in front of you. Throughout your medical training, you will hear the term focused physical exam. This differential-driven physical exam is what they are referring to, and the neurology rotation is an excellent place to start developing this skill. So how do we formulate a differential diagnosis in neurology? Let's start with our discrete components of the nervous system. In neurology, common pathologies are autoimmune, infectious, cancer, metabolic, and genetic. For example, We can see how the possible inflammatory diagnoses vary based on localization. Inflammation at the level of the muscle yields a differential including polymyositis, whereas inflammation at the level of the peripheral nerve yields a differential including Guillain-Barré. It is helpful to mentally review a form of this cross-reference differential diagram before seeing your patient. Each location can be affected by various pathologies, so we use the patient's history to inform our differential, organized by localization, and then the differential determines our physical exam maneuvers. So how do we put all this together and approach a patient in neurology? Let's meet our patient, Jane Mylan. Hi! And let's say she's a 25-year-old female who's coming to your clinic for abrupt onset difficulty walking. Let's start with the tools we just covered. We need to consider a differential for what could be causing Jane's symptoms, organize that differential using localization, and select exam maneuvers based on each diagnosis. What neuroexam maneuvers are we going to expect to use based on our suspected diagnoses? For example, because we are suspecting MS on our differential, and MS is a disease of the CNS, we would select the reflex exam in order to localize to upper motor neuron, which indicates a CNS pathology. If we were to elicit hyperreflexia, this would support diagnoses like MS. We would continue this process until we provide evidence for or against each of the conditions on our differential. To summarize, neurology is a focused cerebral specialty that will challenge you to navigate the nervous system as a third-year med student. Remember to work on developing a neuroexam that is specifically curated based on your differential. Practice localizing the chief complaint of all the patients you see on this rotation in order to develop your skill in prioritizing neuroexam findings. And finally, always consider a differential that initially encompasses all regions of the nervous system, but is then narrowed by your exam findings. Thanks for watching Clerkship Paradigms, your travel guide to the third-year clerkships. Please fill out the post-video survey and tell us your thoughts. Good luck on the wards.